I think it's important in defining depression to realise that depression means different things to different people. So depression is a normal part of life. We all get sad, we all get distressed at different times, but depression can also move into where it becomes actually something that's quite disabling and people can consider an illness. And depression, when it becomes an illness, is something that affects not just your mood, but your body. When someone moves beyond having just a feeling of being depressed for a short time, they may have a number of symptoms that go with that. They include changing their appetite, most commonly a reduction in appetite, but it can be an increase in appetite. It also can be a loss of concentration, loss of enjoyment is really important things. That when someone can't do those things that they normally do and enjoy those things, and that keeps on happening for a long time, then that's something people need to start to worry about. A time when people particularly become worried about depression if someone starts to have ideas about not wanting to live or that they're burdened and that life isn't worthwhile. And if those thoughts start to come, then it's very important to seek help quite urgently for depression. There's a very wide range of management options for depression. Whilst medications are often what people think of as the thing that people provide for depression, there's actually many other things that will be used, and most commonly those things actually will be used before medication. Medication's only used as a first-line treatment for depression where the depression is severe or moderate to severe, and that's where it's really interfering with a person's quality of life, where it's interfering with their safety. So before someone even goes to see a doctor, they can think about their own lifestyle, they can think about their sleep patterns, whether they're getting enough sleep, look at the alcohol, look at whether they're using any drugs of any form, including prescription medications. Also thinking about, are they actually regularly doing things which are enjoyable, or things they normally would do, and exercise. So those things can be very important before you see a doctor. And then in terms of actual formal treatment, there's now a range of non-medication treatments. That includes things that are on the internet, so the e-therapies, whether it be on your app, or whether that be on the web in other ways. It's really when lifestyle change and talking therapies aren't working, or where depression's more severe when one looks at medication. There's no one right medication. So what might be the right medication for one person may be a really bad option for somebody else. And so there is an element of which really you have to try and find out which is the right medication for you. So if you think about taking an antidepressant, the really important thing is knowing what you want to talk about with your GP. So it may be about side effects, it may just be a question about what side effects do I need to think about. But there's other questions that be important for people. It might be, how much is this going to cost? How long will I have to take this medication for? How quickly might it start to have an effect for me? What should I be looking for in terms of whether it's having a positive effect or a negative effect? But there's not one right set of questions. It's the questions that are important for you, so plan them out. If you feel you need to write those down, that's fine. If you feel you want to have someone come along with you, and so you've had that discussion with them to make sure you ask those questions, that's fine as well. So just plan that time with your GP. So I think the most important thing.